My name's Judith Smith and I'm the Chief Nursing Officer of the Royal District Nursing Service of South Australia. RDNS is a community-based organisation that provides care to people in their own homes and their communities. The launch of this new brand is our next stepping point towards our future.
It's more than just about a new look. It's about painting a picture of the future and a vision for the future. It's about promoting wellness, it's about promoting learning. It's about enabling people to take control of their lives and control of their health.
There's always been a need for the services RDNS provides. That need's grown as the population has, but so has the burden of chronic disease that we see in the community. So there's a great need for services such as palliative care that enables people to die in their own homes with comfort and dignity, surrounded by their families.
My husband was diagnosed with terminal cancer and he was told he had weeks and months to live. When we found out, I thought there's absolutely no way that I'm going to have Graham go into a hospital situation. They're not places where people should die, because they should be at home with family and familiar things around them and love and be embraced by warmth. I couldn't have done that without the help and support of the Royal District Nursing. They were wonderful to Graham, and in fact he was so grateful he was compelled to write a letter when he was actually in a bed just weeks before he passed away. My name is Graham Marshall and I'm currently receiving palliative care through You Lovely People, and closer to home I am in the care of Andrew Edwards. He's got an absolute gift when it comes to dealing with people in my circumstance, and I think that reflects on the quality of the organisation for whom he works. Thank you, but most importantly thank you to Andrew. Yours sincerely, Graham Marshall.
The number of people living in the community with the diseases such as diabetes, with chronic wounds, the sort of services we offer are services that enable people to stay in their own homes, to live in their own homes for as long as is possible without institutionalisation or hospitalisation. That's why there's a need, and it's a growing need.
Brian has had two persistent wounds, one on his head, one on his back. And the district nurses have been calling for quite a few months now. Not having to turn up to a doctor's surgery 3 or 5 times a week is a huge thing, you know, that they actually come to you.
RDNS come twice a week to me to dress the ulcer I have on my leg. I can have treatment at home instead of travelling twice a week to the surgery. And that really helps.
We've been extremely grateful for their help, been absolutely terrific.
If I need help, I just phone RDNS and I get it.
RDNS was originally established by 3 people, one of whom was a Florence Nightingale graduate from Britain, and they saw the need in the community for people to have health care, and so the first nurse commenced her round in Bowden in 1894.
It's over 100 years of service to South Australian community, and that history goes back to a very localised service to a very local community.
When the first nurses were out there, they were using horse and sulky, the nurse in the Murray used a punt, the nurse in Murray in particular rode a camel. Through
the times, people have moved on from bikes and camels to cars, but the one thing that hasn't changed is the care. Technology for us is important for our staff and our workforce, and it's important also for our clients.
Community nursing is primarily mobile, so we look to leverage technology to actually provide services to clients in the easiest possible way that we can, while leveraging tools to make the day-to-day job of our healthcare providers easier. We've done that through using tools such as mobile technology, so we can provide quality information at the point of care. Also leverage telehealth, which is about providing video facilities into client homes so we can make phone calls to check on clients' welfare and to support them in the medication administration. We're able to monitor their vital signs and their environmental conditions to ensure that they're in the safest, most clinically appropriate environment. Telehealth allows us to reach people that we couldn't traditionally reach through cars. We're actually able to talk to people in regional and remote Australia and provide them with clinical care appropriate to their specific need. eHealth allows us to share clinical information about a person across the multiple people involved in their healthcare. Not only does this give our clinicians the best information while they're delivering care, but it allows us to capture information about that care at the point of care, so we always have an accurate record of what we did, why we did it, and how long it took.
Working with technology and embracing new systems of work has gone on. This is nothing new, this is just the next step.
So the future, based on that history, is very, very exciting.
Our future as we see it is about providing increased number of healthcare services and increased number of services to people in their own homes and their community. We have a really vibrant education centre that delivers training to trainee nurses and care workers. We see that growing under this new brand.
I see RDNS in 10 years' time across Australia, working in some of the most difficult and remote parts of the country, known for its history of its nursing, but particularly known for the broader range of healthcare products and services, and known as the organisation that actually marries technology with people through its clients, its carers and its staff. We believe that through identifying and defining ourselves as a social enterprise, we can make a better difference and improved impact on the community. So if a social enterprise means for us creating an organisation that actually uses the best principles of business to actually create a surplus of funds which we can then put back into areas where the most health disadvantage occurs in Australia, and have an organisation that is focused on its own sustainability.
RDNS is an absolutely wonderful organisation. I know the staff out there delivering care in people's homes make a difference in people's lives absolutely every day. I think it's a very special place to work.